Entertainment Tonight, the most watched entertainment news program in the world.
Okay, so you've done the diet and the exercise, but maybe you need just a little more help. Well, tonight in our New Year, New You series, new cosmetic procedures to help you look your best. For some, the problem is saddlebags and cellulite.
I've tried the cellulite creams, everything. My diet's really good, and I still can't get rid of the side pockets of fat there. It doesn't matter what I do.
The BodyTite program uses radio frequency energy to melt fat and tighten skin.
It's heating it, liquefying it, and removing it as you go.
BodyTite, I think, will be a big benefit for the stars that want to avoid cellulite articles. I tell patients that they will look acceptable, bikini-ready acceptable within 3 weeks.
The procedure is so gentle, you can get back to your normal activities almost immediately.
Because more and more men are opting for plastic surgery, actually, to keep them looking young. So in today's personal story, we follow Albert, a young dad who wanted to change up his looks.
When I'm walking down the street, I feel like people are looking at me. Just this little gall in here that really bothers me whenever.
Look at you with the fish.
No, put that away.
My dad's going to be doing a procedure to fix his chin, so he doesn't have the fat sticking out.
I think the day after, you know, taking care of it. The bruising, swelling, things like that. That's, I think, to be expected. Or otherwise, I'm really, really excited for him, so.
This is an example of how my chin used to be. I'm getting older, and I feel that I need a little bit of a change, and just to bring my self-esteem a little bit more up. I decided to go see a specialist. He's going to be doing what's called a SmartLipo. I know I've heard in the past, oh, it's only women that are doing these kind of things, but I don't think that's right. A lot of men are going through these procedures today to better themselves, to look better, to look younger, to feel better about themselves. So I don't see anything wrong with it. Hello.
How are you?
Good, how are you?
Good.
I'm going to see Dr. Mulholland for 11.
Perfect. If you just want to have a seat, I'll let him know that you're here.
Thank you. I just want it to be over. I'm okay. Just not trying not to think about it.
What we're doing today is very common in men, which is treating a double chin. Now I'm going to do a little bit under the skin. We're going to freeze the fat. Almost done here, Albert. You're doing beautifully. So I'm going to be melting and removing the fat and tightening the skin under your chin. I'm using a little tiny fiber optic laser here. You can see the red beam, and that's going to be melting the fat and tightening the skin while we do this. So this is so far a lot easier than you thought it would be.
Yeah.
Now we're going to phase 2, which is removing some of that melted fat. Okay, Albert, you're doing great. We're almost finished. I'm loving the contour here. Have you told many people about your procedure?
No, only about them.
Women are more and more forthright about their cosmetic procedures. With men, still very hush-hush, very taboo. Whatever they've achieved, they achieve through hard work and through their own determination and not through some sort of sissy plastic surgery procedure. The recovery is pretty quick. There's little swelling, little bruising. The risks are low, but anytime we use any type of laser or light device, there's a risk of irregularity, asymmetry, not having good skin tone and loose skin, or a little burn where there may be excess heat. We have very much a culture of youth and beauty that is particularly focused on women. When I first started over a decade ago, I might see 1 or 2 guys a year. Now, about 20% of my clients are men.
I feel relieved that it's over. So it'll all go with.
You have a boo-boo under here.
Yeah, a little one.
Joining us in studio now is Albert's cosmetic plastic surgeon, Dr. Stephen Mulholland. Thanks for being here.
Thank you very much.
Nice to see you again. How's Albert doing?
He's doing great. His recovery was less than a week, which most guys want to get back to who they are very quickly.
Of course.
Very little pain and discomfort. Guys are very wimpy when it comes to pain and discomfort.
They are more than women?
Oh, absolutely. I
That's
think we're
funny.
genetically hardwired to, you know, take a woolly mammoth's tusk to the abdomen or a shotgun blast to the leg, but don't give me a little flick or a little needle. That's way too much. Where women are more conditioned culturally and certainly as mothers and of children to hair removal and waxing, and they're just subject to more discomfort to look their best. Guys have not been attuned to that.
We're just tougher. We're just tougher. That's
genetically
just, you can say
tougher.
It's all good. It's
Yeah.
all good. Okay, I think we have some before and afters
Yeah.
of Albert. Unfortunately, he couldn't be here today. He had a personal emergency.
So he was looking a little droopy, a little angry. He still looked good for his age, but guys very much about a tight jawline. They want to look, you know, good in the boardroom and good in the bedroom. And 3 or 4
Yes! And there's nothing wrong with that. I like it.
And so 3 or 4 chins generally bothers a guy. They want that Newt Rockney, Clint Eastwood type of jaw.
John Hamm.
Right, and so he just had a little smart lipo of his jawline to improve his jawline. Nothing severe. Something done under local anesthesia.
Yeah, no, we saw he was totally awake through the whole thing, and you were chatting with him.
And he was a bit angry looking. He looked malevolent. His forehead was dangerous looking, and he's a friendly guy. You know?
Sorry, when you say recovery, back to work when?
Oh, he was back to work within 2-3 days.
Okay.
Yeah.
Okay, so did he have to wear that brace around his head for long?
Over the weekend. So a lot of guys do this on a Thursday night or Friday morning, back on a Monday.
Wow.
That's very common. Yeah.
Okay, and is he happy with the results?
I think he's very happy. When I saw him about a month after, he said it's really changed his disposition. He didn't, he's in a job where he has to sell himself, and he's looking angry and sort of dangerous. And so it's given him a stronger jaw, but a more approachable looking brow, because guys often look very frowny and dangerous. And if you're a lawyer or a judge, that's great. But if you're a sales guy, that's not.
No,
you
want to be Mr. Friendly. Yeah, his kids weren't scared of him, which is nice. Right. That's that's good. You said a little bit of bruising, and was he in a lot of pain? Like,
no,
do you have to take painkillers?
No, a lot of people think about lipo and they think they've all seen some episode of Nip Tuck where there's this crazy thing going very aggressively.
You brought the little teeny tiny in, didn't you?
Yeah, this is the would be the SmartLipo probe. It's a little laser filament about 600 microns. And that little filament goes very gently back and forth in the fat, and it melts. Think of a chunk of butter. It melts the butter, and then taking out that melted butter is much simpler.
So you just put a little suction in there and take it all out.
Exactly, rather than trying to extract the whole block.
Which is what was done historically, correct?
Historically, liposuction was mechanically breaking up the fat, removing it. Now we do a 2-stage process. We use an energy system like SmartLipo, a laser, to melt it, and then the extraction is really easy. That means almost no pain, bruising, or downtime.
Thanks so much for being here. It's always nice to see you. We'll be talking to you after the show, you know what I mean?
On today's City Line, it's Makeover Madness. We've got Dr. Stephen Mulholland here and Dr. Jordan Saul, Aesthetics and Dentistry, SpaMedica. But there is this new breed of guy who is out there and is interested in cosmetic procedures. So tell me a little bit about that. What are you seeing more of that in your client base?
No question about it. When I started in 1995-96, I saw one guy the entire year.
Okay.
One guy. This past year, fully 10% of all cosmetic procedures. So about 100,000 men in Canada get some type of physical cosmetic enhancement.
What are they getting done?
Well, you divide it into surgical, non-surgical. Non-surgical would be Botox, soft tissue fillers, hair removal in unwanted areas, hair restoration in desired areas. Those are the top things men do. And then surgically, they get the bags treated, the double chin treated, the 50-year-old male boobie treated, and then love handles. Those are the top 5 things that guys get. So it's very subtle, and if you look at the results of well-done guy procedures, you don't think he's had a procedure. You say, wow, he's looking good, he's looking healthy, looking vibrant, fresh.
Okay, can we talk a little bit quickly before we talk about teeth? Botox and Juvederm, what are the effects of each one?
Botox softens really strong muscles. For example, Carl made a comment that his wife always misinterpreted that he was angry. He was angry at her. And when she saw him with the Botox just in his frown area, she said, wow, for 10 years I've always thought you were irritated. You just move a lot. And so Botox softens movement, and Juvederm is one of the more common fillers, so it adds fullness. I enhanced his jawline so he looked more Clint Eastwood, Newt Rockney-ish. Yeah.
Very cool.
Come on in, Stephen, and we'll get all prepared for your procedure today. So we're going to contour the belt line, the chest. That'll make a big difference in your clothing and your bathing wear. And about 2 weeks from now, you're going to be in tight shirts and on the beach.
At 61 years old, I exercise daily, but I have limitations because of knee surgery. I eat sensibly. It's not my diet and everything that's making me store fat cells or whatever, but it's not going away.
Stephen represents a typical body contour patient. He's got flabby fat. It's loose, and if we don't tighten it, he shouldn't do liposuction because it would look worse. We've got to tighten skin and reduce the fat. We put a device under the skin and into the fat under some IV sedation or just local anesthesia, and that device heats the fat, melts it, then we remove the liquefied fat. Stephen's results are very typical. He notices within a few weeks a tremendous change in his contour, flattening of the chest contour, tightening of the chest skin, tightening of the tummy skin, and improvements in his love handles. So contour correction, skin tightening.
I am feeling very good. I have felt very good from probably the second, third day. I'm very, very pleased with the results, and hopefully it'll last for a long time.
Wow, he should be pleased. Good work. So what are the main areas where men are holding their fatty deposits?
Well, men and women, I'm seeing older individuals, now older meaning that they're not 25 anymore.
Right.
I'm seeing postpartum moms in their late 30s, early 40s, and guys who are older. And traditional liposuction, which removes the fat, the skin can sometimes sag and not look great. So there's a whole host of new technologies like this BodyTite that emits electrical energy that heats the skin and tightens it while you remove the fat, so it matches the skin tone to the fat removal. And so for guys, it's the chest, double chin, love handles, and the Molson muscle.
Yes.
For women, it's usually the hips, the pot, the outer inner thighs.
Yes.
And so these BodyTite type technologies really allow people with compromised skin tone to get contouring without the big incisions, without the tummy tucks and the body lifts and the thigh lifts. So like Stephen, he can be back to his activities within a couple days.
Okay, so you mean this is not for someone who is obese. This is for someone who is very close to their goal body and they just need a little bit of help?
Exactly. So if someone comes in and they're just nowhere near their target weight or what they would feel comfortable at, weight loss, diet, exercise, always first.
Right.
And then something like this, to polish off the contour, to put the frame on the canvas, but you have to create the canvas. This isn't a weight loss procedure.
Okay, very cool. Typical recovery time?
Well, you can be up and walking that afternoon, that next day, but back exercising, high impact aerobics takes 2 or 3 weeks.
You just jump off the table and go home?
Well, not quite jump. you ambulate cautiously.
Checking. Very good, good information. So now, what are you going to go home and tell your husbands? Look, you can just, it's easy. Look at the guy, look great in the tape.
#1 referral source
Yeah.
is women and wives of the husband.
Of course.
They're looking good and they look in the mirror and say, honey, you ain't going out with me looking like that. And they drag them in by the ear to do something.
That, very cool.